Hello, everyone. This is Chadi Alraies from RSH 2025. I'm really privileged to be with Dr. Besler to talk about mitral intervention, especially valve-in-valve in patients with degenerative prosthesis. Christian, thanks for being with us.
Thank you so much.
Yeah.
Thanks for having me.
Yeah. So again, this is the third edition of Riyadh Structural Heart meetings. The valve technology is evolving, and the patient population is getting more complicated. So let's walk through the overview of the valve-in-valve technology that we have now for patients with mitral disease.
So actually, it's a very interesting topic because I mean the population with degenerated surgical heart valves in the mitral position is increasing. I mean we all know the problem of structural valve degeneration, and it's always the discussion, at least in our heart team, on whether to undergo a repeat surgical intervention and a redo mitral valve replacement, or to evaluate the patient for transcatheter interventions. And I think we have made substantial progress in over the last years in terms of transeptal mitral valve-in-valve replacement. We have improved our techniques. We have an improved knowledge on patient selection, and I think there's a really exciting field and a field which is of utmost importance for the future, because the number of patients that we will see with those problems will increase for sure.
So now the mitral valve, we know, or transcatheter therapies are for valve-in-valve, valve-in-mac, or valve-in-ring. Is there any, based on, there's multiple registries done before or trials?
Yeah.
So let's walk through some data or some outcome of these patients.
So we've seen a couple of registry analysis within the last years. The latest one from the ASTS TVT registry, and there's clearly a difference in terms of outcomes for these patients. So the best outcome is really observed for valve-in-valve patients. Some valve-in-ring patients, valve-in-mac patients have overall a rather impaired prognosis, also after valve-in-mac, but that's probably also related to the number of comorbidities. They are severely frail, comorbid patients, so it's a different spectrum of patients that we encounter in valve-in-mac. But the valve-in-valve outcomes are rather promising. Still, we need to improve patient selection, and we need to improve our techniques, and we most importantly, we need a longer term data on the clinical outcome of these patients.
Right. Final comments about mitral valve therapy for like native valve transcatheter. I know it's also kind of come up and coming, and they have multiple iteration of devices. Are we ready yet?
Again, I think we need to work on our techniques, and we need to improve. I mean, edge-to-edge repair is still the workhorse in patients where the anatomy is suitable. We have the transapical mitral valve replacement with the 10-dime systems that works well in a subset of patients, but also has shortcomings. And I think 2025 will probably be a very exciting year, because we expect the first transeptal approach to enter the market. The M3 is currently in an ongoing clinical study, but this study hopefully is finalized soon, and it will be interesting to see how the M3 will then perform in a real-world setting as the first transeptal mitral valve replacement.
Absolutely. Well, Christian, thank you again for your time and for giving us an overview about mitral valve therapy for patients with degenerative or structural or dysfunctional MR. Watch these videos and others on the YouTube channel and on the YouTube and on the website as well. This is Chadi Alraies coming to you from the third edition of RSH in Riyadh 2025. Christian, thanks again.
Thank you.
Yeah.
Thanks.